12. Hospital secrets. Your doctors don't tell you, but you should know. Hospitals operate on unspoken rules and hidden knowledge that can dramatically affect your care, and doctors won't tell you these secrets unless you know to ask. Secret number 1. Your nurse is more important than your doctor. Your doctor rounds once or twice a day, spends maybe 10 minutes with you, writes orders, and leaves. Your nurse is with you for 12-hour shifts, monitors your condition continuously, administers medications, catches complications, and responds when things go wrong. The quality of your nurse determines the quality of your hospital stay more than anything else. A great nurse catches errors, advocates for you, and keeps you safe. A bad nurse or an overworked nurse with too many patients means delays, missed symptoms, and potential disasters. Here's what doctors won't tell you. If your nurse seems overwhelmed or is constantly unavailable, you can request a different nurse or ask about the nurse-to-patient ratio. If one nurse is managing 8 patients when safe ratios should be 4 or 5, your care is compromised. Secret number 2. Hospital-acquired infections are shockingly common. 1 in 31 hospital patients will get an infection they didn't have when admitted. These aren't rare flukes. They're predictable complications of hospital stays. The longer you're hospitalized, the higher your risk. Infections come from catheters, IV lines, surgical sites, and simply being surrounded by sick people and antibiotic-resistant bacteria. Here's what you should do. Watch whether healthcare workers wash their hands before touching you. It sounds awkward, but you can ask, "Did you wash your hands?" Studies show that even with strict protocols, hand hygiene compliance in hospitals is only 40 to 60%. Your willingness to speak up can literally prevent life-threatening infections. Secret number 3. The overnight shift is when bad things happen. Staffing is lower at night. Senior doctors aren't in the hospital. You get residents or on-call physicians who don't know your case. Response times are slower. If you have a choice about when to have surgery, avoid Friday afternoons and weekends. Weekend effect is real. Studies show higher mortality for patients admitted on weekends because of reduced staffing and resources. Secret number 4. You're being charged for things you never received. Hospital billing is notoriously inaccurate. Studies suggest 80% of hospital bills contain errors, almost always in the hospital's favor. You're charged for medications you didn't take, supplies that weren't used, and duplicate entries for the same service. Here's what doctors won't tell you. Demand an itemized bill. Review every charge. Question anything that seems wrong. Many hospitals will reduce charges if you push back. Don't assume the bill is accurate. Assume it's inflated and negotiate. If you're learning secrets that could protect you in the hospital, hit subscribe. We're exposing what healthcare insiders know but rarely share with patients. Secret number 5. Hospitals are loud, and it's destroying your recovery. Sleep deprivation in hospitals is epidemic. You're woken up every few hours for vitals, blood draws, medication. Alarms beep constantly. Hospitalized patients average 3 to 5 hours of sleep per night, and sleep deprivation impairs healing, immune function, and pain perception. Here's what you can do. Ask if vital signs can be clustered. Instead of checking every 4 hours around the clock, can they check at midnight and 4 a.m.? Ask if blood draws can happen when you're awake instead of 5 a.m. Request a "Do Not Disturb" sign if your condition is stable. Secret number 6. Teaching hospitals use you for training. If you're in a teaching hospital, medical students, interns, and residents will practice on you. Your blood might be drawn by someone who's done it 5 times. Your IV might be placed by a student learning the procedure. Here's what doctors won't explicitly say. You can refuse to be a teaching case. You can request that only experienced staff perform procedures. You can ask how many times the person has done a procedure before. Teaching hospitals provide excellent care, but you have the right to know who's touching you and what their experience level is. Secret number 7. Shift changes are dangerous times. When nurses and doctors change shifts, information gets handed off. Critical details can be lost. During handoff periods, usually 7 a.m., 3 p.m., and 11 p.m. for nurses, response times slow down because staff are transitioning. Here's what you should know. If you notice a change in your condition, report it immediately after the new shift starts, so the incoming team hears it directly from you, not just from handoff notes. Secret number 8. Your hospital room's cleanliness affects your health. Hospital rooms are supposed to be thoroughly disinfected between patients. but staffing shortages mean cleaning is often rushed. Bed rails, call buttons, TV remotes, and bathroom surfaces harbor bacteria that can cause infections. Here's what doctors won't tell you. Bring disinfectant wipes and wipe down high-touch surfaces yourself. Clean your call button, bed rails, and anything you touch frequently. Hospital-acquired infections are serious, and you can't assume your room was properly disinfected. Secret number 9. Generic medications are pushed aggressively, but sometimes brand names work better. Hospitals almost exclusively use generic medications because they're cheaper, but some patients respond differently to generics due to inactive ingredients or formulation variations. If you've been stable on a brand name medication and the hospital switches you to generic, that switch can destabilize your condition. Here's what you can do. Tell your doctor what specific medications and brands you take at home. Ask if you can continue your home medications instead of switching to hospital formulary equivalents. Secret number 10. Pain management is inadequate because doctors fear opioids. The opioid crisis has made doctors terrified to prescribe pain medication. Patients in legitimate pain are undertreated because of fear of addiction or regulatory scrutiny. Post-surgical patients are sent home with inadequate pain control. Here's what you need to know. Be specific about your pain. Use the 0 to 10 pain scale accurately. Explain how pain is affecting your function. I can't sleep. I can't take deep breaths. Advocate for adequate pain control. If your pain is uncontrolled, ask to speak with a pain management specialist. Suffering in silence doesn't make you a good patient. It impairs your recovery. If these secrets are changing how you see hospital care, make sure you're subscribed. We're giving you insider knowledge that protects you when you're most vulnerable. Secret number 11. Hospitals push early discharge because of financial incentives. Insurance companies pressure hospitals to minimize length of stay. Hospitals lose money on patients who stay too long. This creates pressure to discharge patients as soon as they're minimally stable, even if they're not fully recovered. Here's what doctors won't say. If you feel you're being discharged too early, you can refuse discharge. You can request a second opinion. You can appeal to your insurance. Hospitals can't force you to leave if you're legitimately not ready. Secret number 12. Medical errors are common, and most go unreported. Medical errors are the third leading cause of death in the U.S. Medication errors, surgical mistakes, diagnostic errors, hospital-acquired infections. They happen constantly. Most errors don't get reported because of fear of liability and lack of transparency. Here's what you can do. Be an active participant in your care. Know what medications you're supposed to receive and when. Ask what procedures are being done and why. Question anything that seems wrong. Verify your identity before procedures. Wrong patient errors happen. The more engaged you are, the less likely errors will harm you. These 12 secrets reveal that hospitals are complex, imperfect places where excellent care is possible but not guaranteed. Your doctor won't tell you these things because they're navigating the same broken system you are. Knowing these secrets doesn't guarantee perfect outcomes, but it gives you knowledge to protect yourself, advocate effectively, and recognize when the system is failing you. The more you know about how hospitals really operate, the better equipped you are to survive and recover from your hospital stay.